Your personalised care plan will include discussions you've already had with your community midwife about where you plan to have your baby. Home births and midwifery-led birthing units are available for all, but for those with more complex health or social needs, the recommendation from the midwife or doctor may be to have their baby at the hospital. If you think you're in labour, you will need to call the number provided to you by your midwife. This may be the community midwifery team or more likely the hospital. The midwife will ask you a series of questions to establish your needs and agree a further plan. The length of labour can vary greatly from one woman to another. It is important to be prepared for this. For most women, it is around 12 to 24 hours. The hospital may restrict the number of visitors who can be with you when you give birth, as some rooms have limited space. Following the birth of your baby, your midwife will be present to check that you are both well and to support you with infant feeding. If at home, the midwife will ensure you have contact telephone numbers and know what to do if you have an emergency. If you give birth in hospital and you and your baby are well and would like to go home, this will be arranged. The midwife will ensure you have the necessary paperwork and contact numbers. The midwife will visit you at home the following day. It is important to be there, as they will be helping you plan your postnatal care and visit timetable. The midwife can continue to visit for up to 28 days, but usually hands over your care to the health visitor around 10 days after the birth of your baby. You will be offered some examinations for your baby to see if there are any health concerns that can cause long-term problems. These tests are usually completed in the first week of life. These include a hearing test, a full physical examination called the Newborn Infant Physical Examination, or NIPE, which has to be completed within 3 days of birth, and a blood test taken from the baby's heel when the baby is 5 days old to test for any metabolic problems, for example, sickle cell anemia. Prior to any of these tests, the healthcare professional will give you time to ask any questions and talk about any concerns you may have. If there is an increased risk that your baby may be exposed to TB, a BCG vaccination will be offered to your baby. This may be as an additional appointment or before you leave hospital. You should have your postnatal check about 6 weeks after your baby's birth to make sure you and your baby are doing well. They will also ask you about contraception and discuss with you the recommended vaccinations. You can always request an appointment for an earlier check if needed. It's a good idea to make a list of questions to take along with you. Tell your doctor if you are feeling sad or anxious. Looking after a baby can sometimes feel overwhelming. Don't feel you have to struggle alone or put on a brave face. You need to get help, as you may have postnatal depression. Your doctor or health visitor can provide help and support. You are having trouble holding urine or wind, or you are soiling yourself. Having sex is painful. You're not sure whether you have had 2 doses of the MMR vaccination yourself.